We're live. Well, welcome to the 7 o'clock talk. And tonight we're supposed to talk about my chronic allergies and asthma. So, right off the bat, I'll start off by saying I'm Dr. Trevor Miller. This is Nurse Jessica, and I've been a chiropractor for 30 years. I've practiced functional medicine for a long time. I mean, since my daughters were born because they had mitochondrial issues. And so I've always been interested in nutritional medicine. And Jessica here has been a nurse for,
At least 14 years.
and you're on the floor. And
I just did acute med surge, and now I don't.
so when we're talking about chronic allergies and asthma, the first things that when I start to hear people talking about this, when they have allergies, when they have skin issues, and asthma, actually, the first thing I think about with asthma is getting the thoracic spine adjusted and then getting a special antioxidant called picogenol and proanthocyanidins because they've been shown to actually help the lungs, the alveoli, and I know several people who actually keep their asthma very well in check with proanthocyanidins and picogenol. So there is that aspect to it, but there are some people that have like mast cell syndrome and things like that have issues, and then it's down to taking care of those inflammatory issues. Um, I would start to look. Where would you go with that stuff? Because you think a little differently than I do, so that's why we make a good team.
Allergies?
The allergies and asthma.
So I'm a big proponent of rinsing out your sinuses with the Sinugator. One, it takes the inflammation and swelling out, and two, it washes out all the pollen and junk that gets in there. Um, and that's just. Why are you laughing at me?
Oh, because I just
And
remember
as
you did that wax thing with your nose and it made my nose hurt. She did
waxing,
the hard wax with her nose, and we've seen it on TikTok and everything else. Man, she ripped that out of her nose. She didn't even shed a tear. I'm too big a
how does
wuss.
that Sinugator go to that?
I have no
Yeah,
the
that's
mind.
probably you actually need your nose hairs to filter things, but I don't like it, so I get them out of there so I can breathe. I have little nostrils inside and I can't breathe. I'm also too heavy, but that's another story for another day. Asthma, I so I just why do you have asthma? Or do you have asthma because you have are because you're sensitive to things and it's a trigger to respiratory issues? Do you have asthma because you have a disease process going on? Like why are you having asthma, one? And some people just have chronic um, issues like degenerative lung tissues and scarring. Like I don't know. I can't really answer your question because some people probably do need medication,
Yeah, and
and
that's
then there's
a
a lot
fair
of
point.
people that probably could control their allergies and asthma with diet and supplements. So I never want to say that supplements cure everything because that's not reality. Some people actually have processes going on in their body that they're unable to to process air and things in simple things trigger attacks. So I get really nervous when people can't breathe. As I'm never going to be a respiratory therapist. It's not my gig.
So I immediately start to think about body burden and what is there a way for us to alleviate things that are going on in your body that allow us to have other systems work better? So, if you've watched this channel for any time, you've seen us talk about body burden, and I use the analogy of a backpack. And every year you get a year older, you get another brick in that backpack. But let's say you caught You caught a virus, you caught the pandemic hit you hard, whatever. Those are all bricks that go into that backpack, and they can make pre-existing symptoms and system or pre-existing issues worse. And so you want to unpack that. You want to make yourself as anti-inflammatory as possible.
So I have a good. So I always think of our animals. So animals, wild animals that live outside, you don't see them having asthma attacks. You don't see them allergic to things. Like most of them are pretty healthy. But you think about our pets that we have inside, like cats and dogs, and everybody's always, oh, they have allergies, they have this, they well, so one, the food we feed them isn't what nature would have fed them. It's not what they would have eaten in nature. So they're also close to the ground. So they're on carpet all the time where there's mold spores, there's dust, there's dirt, there's things that, and I get that they would be outside in the dirt, but inside we create an environment that's toxic to them. And there's no fresh air in a house. So you'll see cats that lose their hair that have asthma and allergies. You have dogs that can't breathe and they have allergies and asthma and they got hot spots and their hair's all falling out. So it's just body burden.
And so several things that you can do for allergies and asthma. As funny as this is going to sound, get your hormones checked. The first thing that we do, check your hormones, check your stress levels, and then check your gut, because all of those deal with the immune system. And the asthma is an immunological response.
Well, and make sure your environment is clean, but not. So you want to remove the humidity out of your house so that you aren't growing mold. You want to make sure that you're cleaning it, dust covers on your mattress and on your pillows,
HEPA filters,
your HEPA filters,
air filtration.
And if you have pets, so I do have a dog that I love and she sleeps right next to my bed. But I also have an air cleaner right next to my bed. So
and it gets disgusting.
Yeah, we clean it. I clean it often, about once a month. It is disgusting, and you always know when it needs to be cleaned because you'll walk into your room and my house doesn't smell like an animal, but if I think I can smell Libby, then I know my air freshener, or it's not an air freshener, it's a cleaner. So also, I really like air fresheners, but I always try to get the ones that are essential oils. But know that a lot of the cheaper versions, it's actually putting toxins into your house, and if you're not going to open up the windows, you don't actually get fresh air. So you actually want fresh air coming into your house. So those are some things that you can help alleviate some body burden.
Yep. And so, and then when we think chronic allergies, I immediately go to food, I immediately go to gut health, I immediately go to out to foods that you're sensitive to, that you're probably eating, that are causing an immune response.
And remember that your skin is actually the largest organ of your body. So it's not about just what you're putting inside, it's what you're putting on yourself. So your perfumes, your colognes, your fragranced creams. So try to get rid of your hair dyes and your lotions and your potions. And coconut oil is a wonderful product. What's the other one we really like? I do. Castor oil, organic coconut oil. Those are nature's moisturizers. It takes your makeup off. It conditions your skin. It conditions your hair. It whitens your teeth.
So when we look at those things and we talk about those things, that's the way we would start to attack that, to help your body deal with these things. And I can't say it enough. I don't know how many times I have seen children with asthma get their thoracic spine adjusted, and they do so much better. even if it's just from the release of endorphins. They typically do feel quite a bit better, but then tons of antioxidants. So, well, I think that is our spiel for the night. If you do go onto our YouTube page, check out our little shorts we're having now. And if you don't follow us on Facebook, go ahead and follow us there, because you'll start to find shorts that we're doing. Right now, I'm doing a series where I'm teaching you how to read your blood work so that you know what's happening, and then you can start to take care of yourself and take charge of your own health. So, with that being said, we'll see you next week. Bye.